So today we will be talking about how to really think about how we can sleep well while also exploring the negative consequences of sleep deprivation, what really are the impacts of healthy sleep, and then also the how-tos of how to sleep better, no matter what stage or transition period that you might be in. All right, so to begin, just make sure to speak up and ask questions at any time throughout if you do. Otherwise, there's questions at the very end that are assigned for that. And I just really enjoy different images because I think that they can really give us a great image for what we're trying to accomplish. So don't give up on your dreams. We're going to keep working on our sleep. So today, hopefully we can help to better recognize the consequences of inadequate sleep. By the end of this presentation, develop a better understanding of the importance of adequate sleep quantity and not only how much we get, but also the quality of what we get. Be able to describe healthy sleep hygiene practices and maybe identify some ways that we can improve on our own. And then also better understand when to seek help. So what are the dangers of not getting good sleep or enough sleep? And there's this quote, without enough sleep, we all become tall 2-year-olds. And I think that we've all experienced times where we felt like we weren't able to regulate our mood, maybe as good as what we would want, or maybe respond in the way that we want to. And part of that could be stemming from our sleep health. So kind of talking about the consequences here. In order to understand the consequences, I think that it's also important to identify and better understand the two main factors that are driving sleep. So we have this homeostatic drive where our body is constantly trying to look at how much sleep that we've obtained and how much time has lapsed since we last slept. So in other words, we basically have to stay awake for about 16 hours in order to build up that sleep pressure to be able to fall asleep again. And a lot of times when we take naps, we can kind of offload some of that pressure, and there we don't have as much of a drive to sleep maybe when we want to. So that's something that can affect that drive for sleep. And then the other aspect is going to be this circadian rhythm, and that's just where our body likes routine. It's our normal clock, so to speak, of that sleep rhythm. So, we can get up at the same time every day. Our body starts to get hungry around the same times every day. We have different variations in our body temperature throughout the day and the night. And then that all helps to kind of help regulate when we go to bed and when we get up and how alert we feel during the day and how well we can sleep at night. So within those main systems, we've also got specific body systems that are affected by our sleep. And these we know that they're important, but you might ask yourself, well, what exactly is specifically going on for each of these? And so I kind of just wanted to break it down according to system. So when we think about our brain or our cognitive system, with our cognition, our ability to have our attention, our concentration, our ability to regulate our memory, to make memories and really remember both short and long term. We also look at our reaction time. When we have sleep deprivation, we have slowed reaction times. So that can impact our driving ability and worker safety. And if we think about even just athletes or students, just that almost sluggishness in that cognitive space where we can maybe term it as like a foggy brain, and just that feeling when we haven't slept well. When we think about mood, people who have sleep deprivation have more irritability, but there's also an impact on the neurotransmitters that help to regulate our mood. And so we can also be at higher risk for things like depression, anxiety, anger outbursts, and just not reacting the way that we should. Productivity in academia, well, we know that there's a lot more absenteeism when people are tired, when maybe they're present, but they're not fully present in their workplace, so it decreases their productivity. And then from kind of a college or university standpoint, this also affects grades, our ability to do as well as what we would like, because we may not be able to think as quickly, be able to process new concepts as quickly as what we would need, or retain that memory from studying and then going into a test. So I get a lot of questions on how much sleep should I sleep before I take a test. And I can say that, other than the recommended 8 hours of sleep, which we'll get to here later too, but it's also important to sleep. So pulling all-nighters is not beneficial because you don't categorize your new learning and help yourself to remember it. So we really advocate for not staying awake all night to study. And at least one REM cycle or one dreaming cycle can greatly help process those memories and new learning. There's also an increased risk for increased accidents when we don't get the sleep that we need and there's sleep deprivation. People have decreased balance. We talked about reaction times and just more errors at work, whether that's recording information or whether that's actually translating into maybe like a factory worker or things where you could be running large equipment, and then therefore there's a safety risk there as well. And then there's also an increased pain sensitivity. So our brain perceives more pain when we are sleep deprived than when we've gotten good sleep. As far as our cardiac system goes, it's going to increase our blood pressure with sleep deprivation. As well, our heart rate can increase, and it can also increase inflammatory markers in the body. So it can increase inflammation, decrease oxygen, depending on what's causing the sleep deprivation. And therefore, it can really impact even things such as heart disease, heart failure later in life, stroke, heart attack, making you more at risk for those types of concerns. And then as we know that increased blood pressure affects all of our body systems as well, even within our sight and things like diabetes. So those can all be present with sleep deprivation. As far as our gastrointestinal system, and I see that I had deleted this slide, it should be saying that it increases things like insulin or decreases insulin sensitivity. So essentially what happens is that it increases cortisol levels with the stress of our body with having to stay awake. And with that, it can also decrease norepinephrine, which leads to more insulin resistance, meaning that we can't process the foods that we're eating as well. And so then that keeps more of the weight on. So we actually see the scale increase or we have a weight gain. Another factor is that our body will release a hormone called ghrelin, which actually increases our appetite. So it can increase our desire for foods that maybe we wouldn't normally have such a desire for. So a lot of those quick eatery type foods, such as like chips or salty or sweet foods, rather than healthy foods. And we're more out of a demand of just wanting that quick fix to give us some energy to keep going versus taking the time to sit down and make a healthy meal. It can also impact heartburn, making that more problematic during our sleep, as well as increasing our appetite overall. A lot of our gut microbes are developed on a circadian rhythm as well. And so if we are not sleeping in a regular rhythm, it can throw those off too. And then that can also impact our immune system, which leads to kind of these two interesting studies. And I just really thought that this older study, they've kind of redone this too, but even recently with COVID, but mice immunized against the influenza virus responded to the virus after people were sleep deprived as if they had never been immunized. And that was mostly due to the fact of their decreased immune response in response to that immunization because of the sleep deprivation. And we also saw during the pandemic, and still learning from that healthcare workers who weren't getting their sleep were more likely to get COVID than those who were actually getting time for sleep. And one of the interesting things in this 2022 study is that both acute, so even like within 24 hours, and chronic sleep deprivation appeared to disturb the immune response. I really like this slide because it just really kind of gives you a nice general overview of all the different systems that can be affected we talked about the ghrelin, the weight. You're at higher risk for obesity if you get less than, and that should even say less than 6 hours of sleep nightly. Increased risk for certain types of cancers. And again, that can be a kind of a combination of our immune function as well as the rest of the body systems. And if there's any drops in oxygen during our breathing during sleep. But we'll kind of go into a little bit more about a public safety issue with the car crash and just the response time there. But working even locally, it just amazes me how many people do admit to being sleepy while they drive. So just being aware of that and making sure that you pull over at the first signs of drowsiness so that you're not putting yourself or others at risk. And one thing that I did find is that, just aging of the brain 3 to 5 years longer with sleep deprivation. You can you think about, how smoking affects our health overall. And we think about years of our life. Well, now they're also finding that sleep deprivation can be right up there with those negative health behaviors. So when we think about what really matters to us, more in layman's terms, like what do we see out there? And we see an increase in psychiatric illnesses. So all those mood, mental health disorders, depression, anxiety being some of the bigger ones, but really any psychiatric illness, and then an increased suicide risk because of that. Heart disease because of the differences in the blood pressure. Obesity with the different gastrointestinal changes we've discussed, diabetes, particularly diabetes type 2, strokes, cancers, and then of course motor vehicle crashes and accidents. So the CDC actually in the last few years said that sleep deprivation was one of the top 5 health behaviors that we could fix for improving our health in Americans. And specifically for preventing chronic disease, we need at least 7 or more hours of sleep every night. So the prevalence of sleep disorders, there's an estimated about 50 to 70 million adults in the United States who have a chronic issue with sleep or being able to stay awake during the day. And there was this National Highway Traffic Safety statistic that estimated up to about 6,000 deaths, 37,000 injuries, and 83,000 police reported crashes, costing America $12.5 billion as the annual result of drowsy driving. So you can see that this really is more than our health. It's also our public safety. Studies do show that being awake for 18 hours straight is equal to a 0.05 blood alcohol concentration and a 0.1 after 24 hours of staying awake. So the scary thing is that someone who is sleep deprived can go from feeling wide awake to fast asleep in as little as 10 to 15 seconds. And when we have maybe not the most engaging surroundings around us, if we're on a long drive, especially in our area, that can be a big deal for crashes. The National Highway Traffic Safety Report also just stated that that there could be even higher with those injuries and that cost. So after kind of learning some of these disturbing consequences, you might be asking yourself, well, how much sleep do I really need? So there's this quote that happiness is waking up, looking at the clock and finding that you still have 2 hours left to sleep. We'll kind of talk about what might be wrong with that saying, but it kind of gets to the point of, it's always nice when we have more time to sleep. This is from the National Sleep Foundation. So this is the recommendations nationally for the average amount of sleep that people should be getting according to their age. And you can see that in our young adult population, it really should be about 7 to 9. And really up until about age 25, our brain is still developing. And so really we should be at the higher end of that. So I do recommend closer to that 9-hour mark because of that developing brain in young adults. And then those adults 26 to 64 years, that's when we can really see that range more of that 7 to 9. There are some people who we would maybe categorize more as long sleepers, and they are going to sleep that 10 to 11 hours. And then we have some people who are going to be categorized as more of those short sleepers, but they're just not quite as common as what we might think. We might say, well, I'm a long sleeper or I'm a short sleeper. But really, if we were able to march out how much sleep that we need, over a long period of time and be able to get that amount of sleep consistently, we might find that we're a different amount than what we thought. Because most of the population really truly does need 8 to 8.5 hours of sleep every night. And again, I really do push for that 9 in those young college students. Another kind of litmus test, if you will, for how much sleep that your body needs and what it's trying to tell you is that when you wake up in the morning, do you feel rested? Do you feel alert? And that's after a full night of sleep. Are you able to wake up before your alarm goes off? If not, I would ask the question, am I doing the things to help me sleep well? If you are, then also thinking about, well, goodness, is there maybe concerns for other sleep disorders, which we'll talk about later in this presentation as well. And then just making sure that you are setting aside enough time for that sleep. So another question to think about is, are you productive during the day? Do you have the energy to get done what needs to get done? Do you feel like you have a sluggishness, or are you pushing yourself to get through the day? Or do you think that maybe you could add in 20, 30, maybe even 60 minutes to your sleep routine and see how you feel? If you're able to sleep more, then that's a good indicator that maybe your body does need a little bit more. And then I try to always ask my patients, what's the difference between feeling tired and feeling sleepy? Because some people might identify more with one than the other. And being tired just means that you feel a lack of energy, that you feel like you don't have the energy or motivation to get something done, versus sleepiness is actually where, I need to sit down, I need to go take a nap, whether that's during your work day or at home. So tired, you feel no energy, but you can't necessarily fall asleep. And then sleepiness being more of that, you know what, I can fall asleep anytime that I'm given the chance. Another question that people often ask me is, what came first? And people with insomnia and also having mood disorders, statistics show that insomnia preceded, so that means it came first before the mood disorder was diagnosed in 41% of people. And in 29%, the mood disorder came before any of the sleep issues. And then in 29%, they don't know. So it could be that it was one way or another. So the importance of this, I think, is that also that our sleep affects regression and progression as well. So even if we do have a mental health disorder such as anxiety or depression, that our ability to go forward in that, or if we're stable in that, we also have the risk of kind of regressing back if we're not getting good sleep. So I think that that's just an important piece too, that it's not just what's causing it, but what can also exacerbate it or cause it to worsen once again, if we've been able to do the right tools and manage those other underlying conditions. So what is sleep hygiene? A lot of people might think that sleep is just a symptom of caffeine deprivation. And if you're a college student, sometimes it may feel that way with all of the assignments and studying that you need to get done during the day. Seems like there's not quite enough hours in the day. But really, sleep hygiene, there's these behaviors that are categorized as maybe creating more arousal or more of that awake sensation, or decreased sleep continuity. So we just aren't able to stay asleep or get to sleep the way that we would like to. And that therefore impacts our quality and the amount of sleep that we get. It's exceedingly common in our society, and correction of a lot of these different behaviors will actually result in a huge improvement in daytime sleepiness and sleep quality for most people. If not, then I do suggest a referral to a sleep medicine facility is appropriate. So different stimulating factors that we think about would be things like caffeine. Caffeine affects everybody differently, and you might be to the point where you say, you know what, I can drink an entire pot of coffee and still fall asleep. And I believe you. You might be to that point. But what we do see on sleep studies in our lab is that even if you are able to fall asleep initially, you don't get into a nice deep stage of sleep. People are kind of kept on the surface of sleep. And I think about sleep stages as diving into water. And so you're just kept right on the surface. You don't find any of those treasures underneath that are really going to help you feel restored and refreshed. And that's really what we're going for, is that we need kind of just that diving deeper, kind of coming in and out, and then getting all the way down into the different stages, and then being able to come up to the surface again in wake. So the recommendation in the literature, what the research shows us, is that we shouldn't have caffeine within 8 hours of going to bed. So if you're going to bed at 10, then that means that you shouldn't have caffeine at least after 2 p.m. I usually say noon is a good cutoff. And for some people, you might not be able to have caffeine at all. Some people, it does affect them that they're that sensitive to it. But as a general rule, we try to say 8 hours. If you drink caffeine right now up until bedtime, then I usually just say, you know what, it's probably not going to be feasible for you to cut it out right away at 8 hours. You might have to do a stepwise approach, doing maybe like 30 minutes to an hour each day until you finally back it up to that desired point. Nicotine, I'm not going to go into all of the negative health effects that nicotine causes our bodies in this talk, but I will say that as far as your sleep is concerned, it's a stimulant. And so it's going to, you're basically having that tobacco, it's going to keep you again on that surface of sleep, not allow you to get into those deeper stages. And we generally recommend not within 6 hours of going to bed. For some people, I try to say at least 3 to 6. And again, trying to do a stepwise approach to work towards that goal. Bright lights, this one is big for all of us. There's a lot of blue light that comes from the screens, from the fluorescent lights in our offices and our homes, and even that bright light from the television, computer, tablets, even our iPhone. So if you lay in a dark bed or your room and you're looking at that bright light, it kind of just gets shined right onto the back of your retina in the eye. And that tells your sleep center that that's daylight. And so it starts to suppress or push down your sleep hormones, and it actually stimulates or starts to bring up those wakefulness hormones. So then it's harder for you to get to sleep, and you're not going to sleep as well. So a lot of these behaviors are not just going to affect our ability to get to sleep, but our ability to stay sleeping through the night and really affect that quality, which I think that a lot of people, they know that they shouldn't do it because it can affect them getting to sleep, but they don't realize that it affects the quality of their sleep. Another thing with that stimulating factor, not doing these things in bed. And I think that can be hard when we share our living spaces with other people sometimes. Our sleep partner, if they're in the same room, they might not want to watch television in bed. And that can be a source of discontent when the one person wants it and the other person's trying to sleep. So really having them, learn more about why it's important to not do these activities in bed is a big piece of it. Not doing homework in bed, even if you can sit on the floor or if you can set up a space in that room that's outside of the bed is extremely important and helpful when we're thinking about sleep quality. Medications. So there are certain medications that we might have to take for our mood or for our cognitive function. A lot of ADHD type medications are stimulants. They're going to make it harder for us to fall asleep. So just working with your provider and asking if any of the medication that you're on could be affecting your sleep quality is beneficial. And of course, illicit drugs. There's not as much studied on some of these, but really that's why we recommend, aside from all of the negative effects, again, to our bodies, to not have them for that effect on our sleep. Physical activity. So we don't want, going to the gym right before we go to bed for the most part, or house cleaning, doing a lot of strenuous activity before we try to just go home and get into that bed. And that's just because, again, those wakeful hormones are being produced. And then it's harder for our body to go from this more like energized state into a sleep state right away. So, trying to have that transition, it's not extremely well studied. So I do say that if you only have time to work out before you go to bed, I do think that the benefits of being physically active outweigh that. And as long as it's not impacting your ability to fall asleep and you're not finding that it's really impacting you during the day as far as feeling sleepy, then I would suggest to continue. Varied sleep schedules. I think that this is one of the bigger ones, and it can be very hard, especially if you have some classes. I think of our student population early in the morning on some days and then some later in the day, and you have studying or maybe you work aside from going to class. All these things, maybe you do shift work. Again, trying to, if you can't go to bed at the same time every night, but you could get up at the same time every day, that's what's really going to help to regulate your sleep schedule the most, is really focusing on that wake time. So even on days off, it's important to try to get up around the same time. I usually, if people are really struggling, I say within an hour. So if you normally get up at 6, but on weekends you want to sleep till 7, usually your body can do pretty okay with that. But I usually don't recommend longer than an hour discrepancy. If you do shift work, we'll come to a slide with that. So I'll talk more about that on ways to help. And then lying awake in bed for long periods of time. This kind of goes and is coupled with wakeful activities in bed, because we're just training ourselves to do that wakeful activity in that bed, or to lay there and think and not sleep. So our body, again, remember, it likes to establish those rhythms. And so it's just going to say, you know what? Nope, I've established this rut where I now think for an hour about my day, about stressors, whatever the case may be, for this hour, and then I'm able to fall asleep. And the more that we do that, the longer that we get entrenched into that rut. And it just becomes deeper and deeper and harder to get out of. So if this happens to you, if you think, gosh, I feel like I've been laying here for about 15 minutes, not sleeping, get out of the bed, sit somewhere comfortable. You can think, do your thinking there. You can even read something if that's helpful to you in more dim light until you become drowsy, and then get back into the bed. Don't try to fall asleep on the couch or in the chair or in another room. Go back into the bed so that you can train yourself that your bed is for sleep. We usually say that the bed is for the 3 S's, for sleep, sickness, or sex. And we don't do any other activities outside of those. As far as environmental noise goes, you could have a bed partner with something like snoring that's keeping you awake. Maybe you live next to train tracks. Maybe your roommate is loud or has a certain rhythm when they come home or when they're leaving. So just trying to mitigate those as best you can, whether it's with earplugs, whether it's with having a conversation to see if there could be something changed, just so that you can help to make it quiet, have the room dark, have the room cool. And usually around that 65 to 70 degrees is usually what's recommended. White noise is really helpful. So utilizing like an app on your phone where you can just try out white noise, and that's a free way to do it for a night. And then if you like that, establishing that rhythm into your sleep schedule is helpful. Stress, trying to mitigate stress as best we can is really important. Not watching the clock, because your brain pays attention to the time. So if you note the time on your phone, especially, that bright light stimulation plus the time is going to almost be like clockwork, wake you up at that same time every day. If you say, I wake up every morning at 2 a.m., then your brain is going to set that little alarm with that little marker to say, wake you up at that time. So really turning the clock around, if you have a physical clock, not checking your phone is one of the better ways to help with this insomnia, or if that's waking you up. Medications that can make you drowsy. Maybe you have to take something for pain. Maybe you have to take something for a medical condition. Again, talking with your doctor to make sure that it is not causing drowsiness during the day, which therefore decreases that sleep quality at night, is beneficial We talked about the drugs, and then alcohol. Alcohol can worsen sleep disorders. It is going to impair your ability to think or to sleep deeply in the second half of the night. And so it really robs you of that sleep quality once again. And we usually recommend not within 3 hours of going to bed, which can be very difficult for a lot of people if they're out social and that's the time that they are. But just realizing that if it's a regular thing, that can be a big factor, a big piece of your puzzle into maybe why you're not sleeping as well. So we talked about adequate sleep hygiene behaviors. So how can we incorporate those into better sleep? A good laugh and a long sleep are the two best cures for anything, according to this Irish proverb. So I just kind of wanted a nice summary of what not to do from those earlier slides. Avoiding the bright light, avoiding the caffeine, the alcohol, the tobacco, not doing wakeful activities in the bed, avoiding heavy foods or spicy foods before you go to bed. You want something in your stomach to help you sleep, but nothing where it has a lot of sugary, spicy, or heavy content close to bedtime. Trying to limit fluids within 3 hours of bedtime so that your bladder doesn't fill up where it wakes you up. And then not watching the clock, not lying there awake. A summary of what to do. Establishing that routine, I think, is one of the biggest things that you can do for yourself. Managing stress, keeping the room cool and dark, utilizing white noise, whether that's through an app or a machine, exercising regularly. When we take care of our bodies, if we can eat right, exercise right, then that third leg of the kind of that triad kind of comes into play too, where we can sleep better. And exercise is one of the better ways that I encourage people to treat their insomnia, because it just helps to make our sleep more dense as well. So really balance in all things, as we know. It's just really getting intentional about it with our schedules that I think is one of the hardest aspects of all of this. Working that sleep and putting as much of a priority on it as we do on those other aspects of our lives. So what sleep disorders or red flags should we be watching for? And I love this quote, laugh and the world laughs with you, but if you snore, you sleep alone. So I think that, looking for things like insomnia, restless leg syndrome, circadian rhythm disorders such as shift work, delayed sleep phase, where we just feel like we need to sleep later and sleep in during the day, that can actually be a lot of people's primary reason for their insomnia, is that they're trying to get up for an 8 a.m. work job or 8 a.m. class, and their body naturally wants to go to bed at midnight, 1 a.m. and sleep until 9 or 10 a.m. And so it's really trying to work with that shift. And then sleep apnea. So I feel that more so with insomnia, a lot of those sleep hygiene behaviors we talked about earlier can really help at least get people on a good path for treating their insomnia. Signs of sleep apnea, this is probably what I see most in our clinic. And snoring is probably the most common symptom of sleep apnea. But some people have sleep apnea and don't even snore. And so just realizing that it's not always a classic presentation. If anybody's ever told you that you wake up gasping or make choking sounds in the night or cough, or if they've ever witnessed you to kind of have a pause in your sleep, that would be very indicative. I have a very low threshold for doing further evaluation for those types of symptoms. Other ancillary symptoms could be frequent awakenings during the night, whether they have to get up and go to the restroom, which would be like nocturia, the sixth one down. Sweating at night can also be an indication that there could be an underlying medical disorder such as sleep apnea or things like diabetes. Morning headaches. So if you wake up in the night or in the morning with a headache, that can also be a sign. And then this one is also starred, feeling non-refreshed despite a full night of sleep. If you set aside 8 hours and you're getting 8 hours of sleep and you still feel like you're not refreshed in the morning, then it would be a good idea to contact your primary care provider and say, hey, can we just kind of talk about this? What else maybe am I missing? And then that can lead to excessive daytime sleepiness. So having 2 or more of those symptoms that are especially starred, I would say would warrant a referral to the sleep medicine treatment. So briefly, what's happening in obstructive sleep apnea? So again, you don't have to snore to have apnea, but that's usually the most common symptom. There are different forms of sleep apnea, but obstructive is probably one of the most common, and so that's what I'm focusing in on today. If you can see here, so this is just kind of looking at someone sleeping, laying down flat, and granted this person's on their back. You don't have to be on your back to have this happen or with sleep apnea, but that's how this picture is depicted. And so it's just a cross section. So looking at that person from the side, if we were to look inside and see this cross section. So normally the air comes in through the nose or in through the mouth, whichever that they're breathing through. And the snoring you can see makes it just harder for it to sneak past these structures. And then in sleep apnea, where it's relaxed in the back of the throat here, just enough to where it's touching, it cuts off that air supply and it actually keeps people from breathing. Now, when that happens, the oxygen goes down and then the body gets a stress signal and a stress response to increase their blood sugar. It spikes that and then it wakes the person up, not fully, what we call like a micro arousal, where it's just enough to cause that person to kind of, jolt themselves back into getting this muscle tone, and then it opens up this airway so you can get that breath. Most of the time people are unaware of this happening during their sleep, and it can lead to very significant consequences. For sure, things like higher blood pressure, stroke, heart attack, heart failure, diabetes, weight gain, a lot of the same things that can be caused from sleep deprivation. But usually it's a little bit more significant because of the drop in oxygen that's correlated with it, that is often accompanied with it. So again, it's just the relaxation of our throat tissue and muscles to the point where it's cutting off that air. Our body has to respond by opening it up, and therefore it's pulling us out of those deeper stages of sleep. We're not getting that good quality, and we're also getting the negative effects from what's going on with the oxygen. So treatment for this, we've got a lot over the last couple years too. We have not only our gold standard, which is the CPAP machine that people wear to actually push the air into the airway, hold open that airway, and that's with a positive airway pressure device like a CPAP. And then we also have a newer therapy called a hypoglossal nerve stimulator, which helps to move the tongue here. You can see the base of it forward by stimulating the nerves and keeping that tongue forward so that it doesn't fall back into the airway. So depending on how severe the apnea is will depend on what treatment options that you have. So if you have concerns, visit with your primary or visit with a sleep specialist. All right, so shift work here, sometimes we are just in rotating where we have many nights where we've had to work through the night. Wearing sunglasses on your commute home is one of the greatest things that you can do, because again, the light from the sun rising is not, we want to kind of dim that so that it's not going to increase the wakeful hormones and decrease our sleep hormones. So we want those sleep hormones to stay enough for us to get to sleep when we get home. SAD lights, so that is kind of like a seasonal affective disorder light use. Usually about a 10,000 lux is what you can look at for those. I've seen many patients buy those on Amazon, Home Depot, Best Buy, things like that, where they're able to use it. You only need about 5 to 10, 15 minutes, kind of just go in a stepwise approach, but you're doing that when you want to be awake. So when you first wake up, so for shift workers, if you are waking up around 2 p.m., we'll say, you can do it for those first 5 to 10 minutes when you first wake up. And usually you can sit where you just turn it on off to the side here. It doesn't have to be directly into your eyes. You can just be having breakfast or working on something and just kind of having it shine kind of not directly. And that can help, but that decreases melatonin levels so that it helps you, again, to be more awake. You can use this if you want to go back to, you've been working nights and now you need to sleep at night. You can use it in the morning then when you get up. to really help promote that wakeful hormone so that you can stay awake better and then go to sleep that night. Decrease the light when you're trying to go to sleep, increase the light when you're trying to be awake, decrease the noise when you're trying to sleep. Try to keep more of a noise going when you're trying to be awake. Keep to a schedule as much as you can. Try to rotate forward if at all possible. So like working from days to nights to evenings rather than from nights to backwards to evenings and then days has been shown to be helpful. Have a buddy system where you can have somebody drive you to work so that you're not getting so tired. You can use caffeine with shift work. Just make sure that, again, it's not within that time frame of you going to bed, but at the beginning of your shift, if it's going to be helpful to you, go ahead. Try to take several breaks. Some people are very successful taking a nap on their break as long as it doesn't impede their ability to get to sleep when they get home. So that's the whole trick with napping. It's all right to nap if you need it, if you're short on the hours, as long as it doesn't affect you getting to sleep when you need to. And then avoid extending your hours or long commutes. So, if you're working at an 8-hour night shift, try not to work like a 12-hour night shift. It's going to be much harder on your body than just the 8 hours. So again, some of these things can't be helped, but this is how we try to mitigate them as much as possible. So kind of in summary, what can we do? Think about how many hours that you're getting. Try to get at least 7 to 8 hours over a 2-week time frame straight through, and try to be as routine as you can within those 2 weeks. If you feel better, maybe that was your issue. If you're working on sleep hygiene behaviors and improving those, and you've set aside 2 weeks and you're getting at least 8 hours of sleep every night in those 2 weeks, and you're still feeling sleepy during the day, then you need to talk with your primary care provider, and maybe they might need to ask you, do you snore? Has anyone ever told you of pauses in your breathing? Do you have frequent kicking in the night that might indicate another leg movement disorder? Or do you have a complex medical history with like high blood pressure or diabetes, where maybe some of these underlying sleep issues might be maybe a little bit more subtle? And then individual tips. Again, we talked about optimizing your sleep behaviors. Identify if you do have risks for disorders. Cognitive behavioral therapy has been largely proven to help sleep quality and insomnia. And there are a couple options online. Some of them are free that I've listed here. Some of them have a cost associated with them, but you can actually get your own coach if you want to through an online app. And so that might be something that would be useful to you. Practicing meditation and mindfulness can help your sleep, but also help improve your mood. Making sure that you are giving yourself some of that rest break, some of that brain white space to be able to deal with things that bother you during the day, so that you're not just suddenly go, 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 and then getting into bed and then your mind takes over and thinks, because that's one of the biggest propensities of just thinking and laying there awake. And then, like I had mentioned earlier, light exposure. So that 10,000 lux blue light in the morning can be very beneficial to people, but if you don't need it, it might make you feel sleepy earlier, just because it is affecting that melatonin production. So just being careful with that. If you're using it for your mood, it could affect your sleep, and just realizing that it could affect that. So keep speaking up for yourself. If you've told somebody about some concerns that you've had, go ahead and go back to them and say, you know what, I've learned some additional things. I think that this is still a problem. Advocate for yourself, advocate for your friends. Keep learning, because that's the more that we learn, it's actually proven that if we learn something new, it can help improve our sleep quality as well. But also just to keep learning about sleep and how we can maybe look at our own practices and our routines. And then remember to keep going back to the basics. A lot of times I say that sleep isn't rocket science, but at the same time, small little subtle changes can make a big difference. So some people say, you know what I need to do, but at the same time, I have not gotten myself into the routine of doing it. So small changes, small steps, starting with those basic things and then kind of working from there. And then just really being positive, because you guys have all been here today. Be gracious with yourselves that you're making an effort. And, if it doesn't go well one night, we don't want to increase that anxiety. Like, I'm just not going to be able to fall asleep tonight. And then we almost produce this arousal sensation instead. Just being gracious to say, you know what, well, I guess that didn't work, and I'm going to try something different, and allowing to give yourself some time to make those adjustments, because sleep doesn't change overnight. Try to implement one thing in a 2-week time frame and kind of work from there. So it can take some time, but sticking with it is half the battle. So thank you so much today for your attention, and I would like to open it for questions.
If anyone has questions and doesn't want to unmute, you can put them in the chat. I'll monitor the chat.
Thank you.
I have a question. If no one is ready to go. How valuable, if at all, are accelerometers or like a Fitbit for monitoring sleep quantity, quality? Are they at all valuable, or is it just depend?
Great question. I think it does depend on the person and the technology. So there are some that might monitor, they might say that they're monitoring your sleep phases or your sleep cycles. And those are getting better. I would say that they don't quite match what we have in our lab as of yet, like our actigraphy watches. But I do think that they're very useful in certain ways. For instance, if somebody is really trying to be intentional about increasing their sleep, I think it's a really nice way for having almost like a sleep log, where you're keeping track of, what time you're going to bed and when you're active. So again, the more active that we can be during the day, the better our sleep can be at night. So, really kind of just looking at that, kind of overall big picture of what are my rhythms, so to speak. One caveat to that is that if you're the person that's overly anxious about, I'm doing all A, B, C, D, E to get to sleep and it's not working, then sometimes I call it like a sleep performance type, where you just get so worked up about how you perform on your sleep, it can almost be a distraction. So where it's people are so focused in on the numbers, they're not allowing themselves just to do the work, rather than getting anxious about what their numbers say. So if that makes sense. So there's pros and cons.
Got it. Thank you. Thank you. I don't see any in the chat.
Okay. Well, I'm good to sit here for a little while too, if people are thinking.
All right. Well, wait, let's see. We do have a question in the chat. What are your thoughts on the move to make daylight savings year-round?
I think that people have a hard time with the transition, and so I'd be in favor of it. I think depending on when you choose to do it, I think that that's important, because some people's bodies are more towards like that later. Obviously, we want as much daylight time as we can, especially in our area of the country. But I would say that in general, people do struggle kind of moving that 15 minutes, the week before or the week after adjustment. So I guess I'd be in favor of it from what I know now.
Thank you. It looks like we have another one. If from Callie, she says, if someone has had a sleep study that shows no apnea, but some significant restless leg activity that does not appear to be related to iron levels, what might be the next step for them?
Great question. So depending on how long it's been from the sleep study, I usually always ask about weight changes, because some people may not have apnea. And then if there's any weight gain, they could have tipped them over into having that. If that's still not the case, and definitely no apnea, and it's just these restless legs, it's not related to any iron deficiency like what has been described, then I usually say that medication would be applicable in that case. And usually the guidelines do indicate or do state that, something like a dopamine agonist, we've got a lot of different tools in the toolbox, so to speak. Gabapentin is another one, but it really depends on the person and their past medical history, what other medications that they're taking. And so that's very much decided on an individual basis with the person.
We do have another one here from Tiffany. Do you think that having pets sleep with you negatively or positively affects your sleep?
Mm-hmm. That's actually worded well because, for the most part, what I find in clinic is that it is a negative aspect in the fact that, pets usually are going to be getting up to have to use the restroom, to be let outside, jumping in on the bed, getting tangled up in legs. So usually it is a source of awakening for people. I understand that there are certain scenarios where having that reassurance of having a pet can be such a calming thing for people and maybe such a beneficial thing for our mental health that I think you kind of have to weigh the pros and cons. But from a strictly just a sleep quality standpoint, it's usually shown in a negative light.
Any other questions? We have a couple minutes left here.
Mm-hmm. Great questions, by the way.
Yeah. I'm not seeing any more come through. So I think we'll wrap it up there. I just want to thank you, Heidi. That was awesome, very enlightening. Definitely some things that I need to keep in mind. One of which was the just when you can't fall asleep, you're thinking just getting out of bed. That seems, I don't know, that's kind of counterintuitive to me, but the way you put it made a lot of sense.
It does. And I think that it's also one of the ones that people most struggle with because our bodies are tired, but our minds aren't.
Yeah.
Yep.
Awesome. Well, thank you again. Thank you all for joining us. We'll be posting this on our webpage, and then you can also see it on Facebook. It'll stay up on our, I think it's still called the wall on there. All right. Well, thank you very much.
Thank you, everyone. And thank you for your time and attention. And I hope that some piece of it has been helpful. So thank you for having me. Appreciate it.
Thank you. Everyone have a great day.
Well, thank you, Logan. Is there anything else that you would need from me?
No, that was awesome. Thank you so much. I don't know if you were looking at the chat, but I mean, there were a few comments in there during the question period where people were just, giving some thanks. Some might have gone directly to me by accident, but
sure.
thank you. I see some direct message, but says thank you so much, Heidi. So so lots of thank yous. It looks like people really enjoyed it. I definitely did. So yeah, thanks. Thank you so much for your time. I appreciate it, and all the help with the website and whatnot too. That was great.
Oh, not a problem. I am happy to help. I love anything sleep related. Sorry that sometimes, like I said, spring gets a little crazy, but I appreciate being able to be here.
Totally fine.
All right.
All right. Well, have a great day.
You as well. Thank you.
Thank you.